Hi, Alyssa. So, first of all, could you introduce yourself and give a bit of background info, such as where you're working right now or any projects you've been working on?
Sure, absolutely. Thank you so much for having me today. It's a real pleasure to speak with the two of you, and really excited to be here and be talking about my experiences. So, my name is Alyssa Chiatao. I have an MPH specializing in epidemiology from the Dalalana School of Public Health. Um, I work as a clinical research project coordinator at the Hospital for Sick Children, and our research team focuses on the field of psychosocial oncology, which is really centered on designing interventions and initiatives to support kids with cancer and their families. So we work on a wide range of projects, that are centered on either engaging families and patients and clinicians in research initiatives. So right now we're working on a Canada-wide initiative to engage these patients and families in setting a Canada-wide research agenda. So that really puts key stakeholders at the center of kind of guiding research on childhood cancer. We also work on different, developing and evaluating interventions within the domain of digital health and mobile health. And so what that really means is we try to develop support interventions that help kids with cancer manage their pain, essentially. And so what that might look like with our research group is designing apps that parents or kids can use to help kind of manage the pain that's associated with cancer or its treatment.
So you mentioned at the beginning that you had an MPH, right? So can you just tell us a little bit more about what that is, how you decided to go there, and how it's helped you?
Sure, absolutely. So, what an MPH is, how I decided to go there, and how it's helped me. So, when I was in high school, I had no idea what epidemiology was, or kind of, I think I had a very vague idea of what public health really meant and what it meant to be a public health professional. So, an MPH is a Master of Public Health, it's a professional degree, and it allows you. So it's a little bit different from a master's degree that you might do where you're conducting a research project or you're working on a thesis. My master's degree, the MPH, is typically a course-based degree where students really focus on taking classes that build their epidemiological skill set, their public health knowledge, and they kind of equip students with tools that they'll be able to use when they enter the workforce. But as an MPH, I still had the opportunity to participate in research and to really grow my interest in working with patient populations and conducting research in that domain. So that was still an option for me as a student. But yeah, that's a little bit of what the MPH is in a nutshell in graduate school, and what if you go to graduate school for public health, what you could generally expect. It is a professional degree. When I was in high school, I kind of, and in my undergrad, I kind of had a vague idea of what I wanted to do with my career as a high school student. I did like a specialist high skills major with the SHISM program in healthcare, and I learned a little bit about the healthcare field. I really liked interacting with patients. I really enjoyed that experience. But then and then when I went to undergrad, I was introduced to the field of academic research and really involving myself with professors or research labs at my school and learning about how to contribute to research initiatives within a laboratory environment. And that was really exciting for me too. And so that in participating in academic research as a student, I was eventually stumbled on an opportunity where I was a summer student at the Sunnybrook Health Sciences Center. And it was a really exciting opportunity where I worked in the interventional cardiology department, and my supervisor and my coworkers were educated in the field of epidemiologists. My coworkers were actual epidemiologists, and my supervisor, I believe, is a clinical epidemiologist. And I was really introduced to that field, and I thought, like, wow, it's so interesting because it showed me how public health and epidemiology are used to inform interventions or solutions that impact the health of populations at a wide level. And so as a student there, our research was focused on, guiding or informing the guidance, informing the treatment, I should say, of patients receiving interventional cardiology procedures. And that was really interesting to me, that like this is basically the information that doctors and other clinicians use to make decisions about how they care for patients. And I thought, wow, that's really interesting to combine an interest in research and an interest in healthcare to have these lasting impacts, or these kind of large scale impacts. Because in learning a little bit more about public health and coming away from that experience, I started researching what I wanted to do more in my once I graduated. And it really, looking up graduate programs, it really helped me learn about how public health interventions really impact the experiences, and how I guess we experience health, I should say, on a population level, and how it really has the potential to benefit in patients or people or populations and communities on a very large scale. And the scale of it was really what drew me to that career. It also added a lot of context to experiences that I had as an undergrad student, where I tried to volunteer and learn more about the healthcare field. And so, for example, as an undergrad, I went on a volunteer trip to Guatemala, where we worked in mobile clinics, and I had the experience to work with communities there. And it really exposed me to how little I truly understood about the healthcare field, and how nuanced and complex healthcare really is. It's really important to address health from a lens of cultural competency, and really understanding the unique needs and experiences of populations, and how appropriate interventions that address health at those levels are super important too. And so kind of taking together all of those experiences, volunteering and the work experiences, I applied to several MPH programs based on that interest. And I eventually was accepted to the Dalalana School of Public Health, and I really, really enjoyed my time there. I feel like I grew a lot as a professional. I grew a lot as a leader, and it was a great learning experience all around. I think that when I think, Stephanie, related to your question of what the MPH really did for me and what that's done for me, it's been a great experience. It was a great experience, I should say, as a graduate student, immersing myself in Toronto, which is a dynamic, multicultural environment. There's so much going on. There's so much research. There's so many amazing professionals, and students are really exposed to a wide array of projects that they can kind of tailor to their interests. So a lot of my classmates had the opportunity to study like cancer epidemiology, if that's of interest, or infectious disease epidemiology, or if global health is of interest. So I really did try to dabble in as many areas as I possibly could, and really kind of get a sense of what I was interested in and what I liked. And I kind of settled on the field, or not to say I settled actually, but I was kind of introduced to patient-centered research and those types of projects and initiatives. I did a lot of my practicum placements at the hospital for sick children, and I kind of was introduced. The department I worked in was child health evaluative sciences, and that's all about like population health research and influencing patient care at a wide level through initiatives that influence how research is conducted, how knowledge is synthesized and translated, and how that's used to guide healthcare interventions for patients and patient populations. And so that's, I learned a lot from that experience. I also completed a practicum placement at the Center for Global Health Research, which was a great learning experience. I got to learn a lot about demography. I worked with as a part of Dr. Prabhat Jha's group, who conduct research on the Million Death Study, and my particular project looked at examine the demographics of injury-related deaths in India, and that helps me learn a lot about understanding, looking at trends in population-wide data and kind of extrapolating inferences, or kind of making inferences from that data, I should say. And that also taught me a lot about data analysis, data visualization. I worked with an amazing team there, and so that's done. So and that was all through the School of Public Health, and that really built me a lot as a professional. That really helped. Kind of made me think about what competencies I wanted to build, what my interests were, and the MPH did a lot for me in that respect, and also in terms of leadership opportunities and kind of building me as a leader. The student community, just to speak to that as a whole, is such a wonderful, cohesive, vibrant community of people who are so supportive. There's so many opportunities to get involved and to contribute to your school community, to contribute to kind of public health learning and initiatives as a whole. And so that was also a great experience for me as a student. So eventually all of that led to my current role, and I think that I'm really able to at Sick Kids and in working in psychosocial oncology. And so I think that I'm able to apply a lot of the skills that I've learned at the School of Public Health and kind of continue to grow professionally in that respect.